Well, good morning, everyone, and thank you for coming back. Today it's Monday, the 24th of February 2020. Now, I've got some more news for you today that I've collected partly from news outlets to explain things about the nature of this virus. And I've got quite a few emails with direct contacts that I've got around the world at the moment that are emailing me information from the situation on the ground in various locations. Now, basically, I think if the WHO doesn't declare a pandemic today, they're going to lose a lot of credibility. I really don't know quite what is going on there, but we need to declare a pandemic so that governments around the world start taking this seriously, start implementing the measures that we need to prevent the spread of this condition. Now, looking at some of the news, that was Italy yesterday. We don't know what it is this morning, probably a few more. Yesterday, or the day before, it was 100, and the day before that it was 30. So we've got this great increase in cases in Italy. 50,000 people are locked down, and there's police roadblocks to the towns. So people aren't allowed in, and they're not allowed out. The supermarkets in certain areas are empty. That doesn't concern me too much. The Italian government is more than capable of getting food to the area. But it does reflect individual anxiety about what is going on here, I feel. Now, the Italian health authorities are still searching for patient zero. They don't know where this outbreak came from. This index case, who they suspected, has actually turned out to test negative. So it's very questionable whether he was the index case. So a bit of mystery going on there. And again, this raises the possibility of community-based spread, which is concerning. Venice has cancelled its carnival, quite a big deal for Venice. And all schools have been closed till the end of February in these northern Italian provinces. So basically the north of Italy have closed the schools down, all schools. Now, Italy did impose a travel ban from China quite early on in this outbreak. But apparently what's been happening is people have been working in Italy from China, often unofficially, or indeed illegally. And they've been travelling to Italy for work via intermediate countries from which Italy did not have a travel ban. So that's probably partly why this has arisen in Italy. Now, another reason why it's arisen in Italy is probably because we know about it in Italy. So Italy has got good health surveillance systems. They have a good health service. And the cases were readily recognised in Italy. I suspect this is in many other countries where it's not as readily recognised as it is in Italy. So Italy might be a bit of a self-selecting sample because it is able to identify these cases at an early stage and to quarantine at an early stage. And it certainly seems the Italian authorities have done a good job on this and have closed down the areas. Let's just hope it's enough to work in that Italian situation. Now, moving on to the situation in the UK. There's been 4 new positive cases from the 28 that were flown back from Yokohama in Japan who were on the Diamond Princess. So that takes 13 cases in total recorded in the UK now. That's the UK cases in total. But we've got 4 new ones from the 28 on the Diamond Princess. Now, all 28 of the Diamond Princess transferees from Yokohama are in isolation, and unlike previous isolations, these ones are not allowed to socialise with each other, which is excellent because it's probable to possible that more of the 24 that are left uninfected are going to turn out to be positive, and they could infect each other. So I'm glad that they are segregated from each other now. But what does concern me is these 4 new cases that have been diagnosed in the UK in the last 24 hours. None of these had any symptoms a few days ago when they left Japan. They were all asymptomatic. And yet we now can see in retrospect, that they were all carrying the virus that had already been infected at that time. So again, we've got people that are infected showing no symptoms, and we believe transmitting the virus to other people during that pre-symptomatic time. Another 100 people who were transferred directly from Wuhan have been released directly now after 14 days. Now, I believe these people have had 3 negative tests, which is encouraging. But what is slightly concerning is there is information now that suggests incubation periods can be longer than 14 days. And there's certainly confirmed cases from China of 1 or 2 or 3 cases of incubation periods in the 20s of days and one up to 27 days. So basically I am happy because they've had 3 negative tests. But there again, we do know that people that have tested negative have subsequently tested positive. So I'm not quite sure whether to say I'm happy with that or not. I'm kind of not sure about that at the moment. Probably okay, but anyway. Now, South Korea. It's gone up from 206, 433. Yesterday, 602. Sorry, that was yesterday. Day before that. Another 161 cases today. Now got 763 cases. In Korea, 7 deaths. All church services suspended all over Korea. Public meetings discouraged. Parliament is postponed indefinitely. And government has taken the highest level of priority. That gives the government additional powers. Now, Israel. South Korea and Japanese tourists have been banned. There is a case now in Israel and a case in Lebanon. And travellers who have travelled to China are also banned, which does seem to make sense. Now, Iran. Case 0 in Iran, some local sources are telling me, may well have been an Iranian national who travelled to China and back. So it looks like the index case, the person that brought the disease into Iran, was an Iranian national who travelled to China. We don't have the date on that yet. In Iran, officially, there's 61 cases, and deaths now reported at 50 as official figures. And there are cases reported across the country. Now, the first death in Iran, it transpires, was on the 13th of February, but that wasn't announced till the 19th of February. So we've got this delay as the government seek to manage news, which is unfortunate. So that's 13, 14, 15, 16, 17, 6 days delay. A lot could have been done in terms of confinement in 6 days, isolation of infected people in 6 days. Now, this is a direct email I've had this morning from Iranian nationals, and this is a quote. Tehran situation is terrible, with reports of death by the hour. Now, that's from a contact in Iran. I have no way of verifying that, but I know who they are, and I don't believe they're lying. And I'm not sure about all flights, but a lot of flights in and out of Iran have been stopped now. There's no real doubt that there's a huge outbreak in Iran. No real doubt about that, unfortunately. Just some further evidence from contacts in Iran. Again, this is a hospital in Iran. I'm not going to attempt to pronounce it. In Tehran, infected cases have been diagnosed in 2 surgeons, 2 anaesthetists, anaesthesiologists in the States, 2 nephrologists, 2 kidney doctors, 3 nurses and 3 interns. I've been told by reliable sources that those people have been infected, and that's just in one hospital in Tehran. I was alarmed to learn that the religious shrines in the city of Qom are still open with people coming and going, even though we know there's many confirmed cases in that city of Qom, which is a pilgrimage city. So the city is somewhat. Some reports say the city is cut down, but other reports shut down. But other reports say that the shrines are open and people are coming and going. This gentleman here is the deputy of the Coombe Provincial Parliament, and he's infected apparently, giving rise to the possibility that other members of the government are infected. And I was also alarmed to hear that in provinces that are not officially infected, workers are forbidden to use the protective gear so as not to alarm the public. Now this politicalisation is unfortunate. But that's the news I'm getting at the moment. China have cancelled the People's National Congress. Now that's a big deal. This is a big political stunt every year for the Chinese Communist Party. It's a huge thing for them, and it's for them to cancel that is no small thing. Wuhan is still sealed, despite earlier reports that it had been opened. It is not. It is still sealed. And President Li has reported shortcomings. Now that is amazing. That is really quite amazing. For the Chinese Communist Party to admit shortcomings really is quite amazing. But I'm delighted to see they have. I do hope this means we're going to get more transparency from China. Now, the rise in new cases in China is slowing down, according to official figures. So there's still maybe just under 1,000 new cases a day, something like that. But the rate of increase is slowing down. So we were getting more than that in the past. So the rate of increase in China is slowing down. The total number is increasing, but that number is increasing more slowly. And I actually believe this because so much of China, maybe 700 million people, are basically shut down, locked down in China now. So I do believe this report because they're taking such extreme measures to isolate and to prevent communities from mixing, thereby spreading the virus on. So I do believe that is happening. And as well as that, in Wuhan and Hubei province now, that the epidemic is reaching its kind of natural peak at about this time. So epidemics reach a natural peak. They go higher and higher, then the number of cases level off, and then eventually they'll start going down. So we're seeing the number of cases in Wuhan starting to, the peak should be reached. So we would expect, just from the natural evolution of an epidemic, that those cases would start to level off now. But of course, the rest of China, there's going to be a lag behind that. And of course, the rest of the world, there's still a lag behind that. So Kuwait and Bahrain, cases from people who've recently returned from Iran. Now, if the Iranian figures, the Iranian official figures, I'm pretty sure there's someone from Canada who arrived back from Iran as well. So if we do believe the official cases, if we believe there's 61 cases in Iran, then we have to believe that these cases in Kuwait and Bahrain just happened to bump into one of the 61, that the person from Canada just happened to bump into one of the 61 in a population of 50 million or more in Iran. So that stretches credulity, doesn't it? So we can get a lot of information actually from travellers. So if we've got travellers in Kuwait, Bahrain and Canada all coming back from Iran, all testing positive, all having been to different parts of Iran, then to me that means that the situation is widespread in Iran. And the reports I'm getting from contacts on the ground in Iran are distressing, quite upsetting. People do seem to be dying in quite large numbers in Iran. The situation is almost certainly the same in North Korea. We believe, the South Korean authorities believe, there's a lot of deaths in North Korea, and I do suspect strongly that is true. So that was just a quick news report. I've got some interesting science to bring you later on if I get time. The World Health Organization needs to declare this as a pandemic, and we need to start taking much more stringent measures now in terms of reducing international travel. the idea that you would take an international flight at the moment just for a holiday is, we need to think seriously about reducing our connectivity for a period of time. Even in countries like the UK and the States, I think we need to start bringing about some social change now. So I suggested at church the other day that people are going to have to stop shaking hands for a few months, stop hugging. We learnt about this cultural kissing in Iran yesterday. That needs to stop. Social kissing needs to stop. Just for a period of time. I think we do need to moderate our behaviour, and of course we need to pay great attention to hygiene and preventing the spread of this disease. Now, I'll just say one more thing. That's not going to stop the disease. I think this will continue spreading, but what it will do is it will slow down the spread and give us more time to prepare. And also, as you know, one of my great fears is that there's a lot of people that are going to be ill when they catch this. So 80% of people are probably going to get mild infection, which is great, and then hopefully make a full recovery. We hope. But maybe 14% of people are going to get more severe disease and need oxygen and medical care. About 5% of people are going to get a critical condition probably and need quite a lot of medical care, or almost intensive care, or indeed intensive care sort of situations. And we can't deal with thousands of those at the same time. So if we could slow this down and we can stop the pandemic from the numbers of cases from doing that, from going up and down really quickly. So we don't want it to go. So if we take the number of cases here, the way things are going, the number of cases in the world is kind of going to go like this. Now we don't want that. We can't really cope with the proportion there that are going to be ill all at the same time. What we want is more for it to go something like this. Well, we don't want it, but this will be a lot better if we can go kind of like that. So we can delay the glut of cases, if you like. That would be good to delay that. And that would mean that we could care much better for those that get the complications, because in this situation we're not going to be able to. So that is the aim. I'm not saying the aim is to stop this pandemic, but we could dramatically slow it down. That means we can treat poorly people a lot better, and that means the case fatality rate will be a lot lower, and that means the death numbers of complications, the pneumonia and the acute respiratory distress syndrome from the COVID-19 will be less.